by the National Executive Director of the SA Federation of Mental Health, Mrs. Bharti Patel. Thank you very much for joining us. South Africans today are in disbelief and shock, actually, that as many as 94 people, and the count is going to go higher, could die in what is supposed to be care facilities. How could this have happened?
Peter, firstly, I think we welcome the report by the Health Ombudsman, which has a lot of detail. A thorough investigation has taken place. We actually commend the report because we have very clear findings and very clear recommendations that need to be acted upon. But like everyone else, one still questions why was this allowed to happen over a lengthy period of time. Since 2015, various civil society organizations, together with Section 27, raised concern with the Department of Health and actually cautioned in terms of this move. It's not a simple decision to be taken. These are people with families, these are people with health conditions that need to be treated. They are fragile people and they should be cared for with all resources available to them.
What would you say are the most important lessons that we've learned from this episode?
I think firstly, if you look at the history of mental health in South Africa, it has always been under-resourced and has never been taken seriously by the Department of Health. Hence there was a mental health summit, and out of that summit we have the mental health policy framework. And that policy framework was also launched in 2013, but even to date we are not seeing any progress nor accountability in terms of that report. So I think what came out today was a clear disjunct between national government and the provincial government, which is actually impeding services to mental health patients. And we are really calling for provinces to account to the National Department of Health so that we can see progress.
So 27 facilities, all of them unlicensed, and one of them had been operating for more than 15 years. How is that possible?
I still have to come to terms with that, Peter. We have organizations that have been in existence for over 100 years. But each year, there is a monitoring and evaluation around these facilities conducted by government. And government is responsible for licensing. And how these administrative processes unfold is surprising, because if one has to open a mental health facility or a residential facility, there are rigorous processes one has to go through to make sure that you receive your license.
So these were not followed, but you know, we heard from the Ombud, people were dying of thirst, hunger and cold. This must mean that these places are awful beyond measure.
I think it's so disrespectful. You know, I mean, what is the basic human need? It is nutrition, it is shelter, and it is decent living conditions. And mental health patients were, you know, one of the things that has come through is that even if these NGOs did exist, forcing more patients into overcrowded facilities will result in patients, you know, sleeping on the floors, not having enough food. Various NGOs, they really struggle. While they do excellent work, they need to go and look for additional funding from donors just to make sure that they can provide decent care.
Why do we need these NGOs? You know, I saw this ratio again. For every one death of a mental patient in a hospital, 19 are dying at these NGOs. They seem to be dangerous.
And that is a very real concern. That the report actually paints all NGOs with a very negative brush. But if you go and visit existing NGOs that are doing majority of the work, in South Africa most of the services are provided by NGOs. The state doesn't do any of the direct services.
Shouldn't that be a state function?
It is a state function. The state subsidizes at a very, very reduced rate. The Health Ombud even showed in his report that while the Department of Health was paying 10,000 per patient a month,
10,000 Rand.
10,000 Rand,
Wow.
they only pay NGOs not even a percentage of that. And that is deplorable. How do you expect NGOs to look after patients in community-based facilities without providing the decent resources that go with it?
So is this a failure at national level, provincial level, municipal level?
You see, at national level, there are policies and legislation. But what we find is that there is a lack of implementation of these policies and legislation at provincial level. This is a blatant disregard of the mental health policy framework, which shows that there should be a person-centered approach. Our clinics, our hospitals, community resources should have been in place before any decision was made to relocate these patients.
I know that SA Federation for Mental Health is a lobby group, in part advocacy. Have you ever approached the MEC for Health, Gedani Mahlangu?
Peter, we have recordings. We have asked for several meetings, and we've attended several meetings. We've presented reports cautioning the Department of Health. Every step of the way. We were part of the litigation in January 2015, where we asked that the process be stopped. But, you know, when you meet with health officials, it seems as though there was such a rush. And we were told that either we didn't have our figures correct, or that, you know, our cautioning was really worries that would never happen.
But you were talking to health professionals inside the health department. How could they not see what you could see?
I really have no idea. And, you know, it angers a person that despite the warnings that you refuse to listen. And, you know, does it cost lives for people to stand up and listen, or for something to happen? What is welcoming is the fact that the Gauteng Premier, as well as the Minister of Health, have promised to allocate decent resources, sufficient resources towards mental health services, and we will be making sure that that comes to fruition.
So some of these facilities, in fact all of them, have come into question. Section 27's Mark Haywood suggests that maybe a wider inquiry is required to see if there isn't perhaps a procurement issue here, and that there might be other pressures that were brought to bear to make sure that these transfers happened as quickly as they did. Do you get a sense that maybe there's a little bit more than just obstinance here?
I think so. You know, for a long time, NGOs, in their discussions with government departments, have been silenced. NGOs would do needs analysis of communities and present findings, advising government in terms of what resources and services are required. And you must remember that we are talking about the poor, the marginalized, and the vulnerable, which is the state's responsibility. And they are duty bearers who should be held accountable. As recipients of services, communities have the right to advise government and ask for decent resources. You know, I attended a workshop on NGO funding, and we find that government officials either lack understanding of the needs of communities, or they have certain budgets, and it's more an administrative process rather than the heart feeling the need to serve the people.
So the health officials weren't listening to you. Did you try and take it higher to the Premier's office, for example?
Every attempt was made. We've made reports to as far as National Department of Health. The Minister had instigated various investigations, and he's also called for the Health Ombudsman to do the investigation. So, you know, we've tried our best. We really applaud the Health Ombudsman for being as objective as he was, and doing as wide an investigation, because his findings are quite real and factual.
All right, Bharti Patel, we're going to have to leave it there, but thank you very much for sharing your thoughts and insights with us today. Let's hope that lessons are learned, and that the outlook for mental health is much better going forward. Thank you so much for joining us.
Thank you, Peter.